Hello, my name is Amy Kupal, and I am the CEO of the Ontario Caregiver Organization. I'm so pleased to be here with you today to share a little bit about OCO and what we do. We exist to improve the lives of Ontario's caregivers, and these are people who are caring for a family member, partner, friend, or neighbor, and providing physical, emotional, and practical support. At the Ontario Caregiver Organization, we focus on 5 key areas that we engage in: caregiver and public information, direct to caregiver programs and services, system outreach and collaboration, expanding public awareness, and sharing caregiver insights and engagement with different parties such as government. And at the center of our work are caregivers. We work closely with caregivers to develop and deliver the programs that we offer free of charge. And we have our caregiver advisory panel and many different working groups to support the work that we do. So I'd love to share with you a little bit about the impact of caregiving and how our work supports that. So we know that caregiving, and I can certainly say this from personal experience, impacts caregivers in terms of how they spend their time, how they balance work and care. It may have an impact on finances in terms of perhaps choices that they've needed to make around employment, but also in terms of out-of-pocket expenses that they may absorb related to caregiving. And it can certainly impact caregivers' own health and wellness, mental, emotional, physical, as well as their relationships. So the impact of caregiving is pretty global on people's lives. And so we want to make sure that our supports reflect that. Now, one of our recent initiatives is the Essential Care Partner Support Hub. And this is an opportunity for us to work closely with hospitals and long-term care homes to ensure that they have an essential care partner program in their own settings and that caregivers are both identified, recognized, and supported in the work that they do. So our support hub provides guidance and coaching. We have resources, tools, and templates, and we bring hospital and long-term care home representatives together for opportunities for learning and knowledge exchange. And of course, we do that ensuring that the caregiver voice is present all the time. Now, we also have our 24/7 helpline that caregivers can call in English and French. It's also available for translation in up to 150 other languages. And if caregivers would prefer to connect with us on live chat, we have that available via our website Monday to Friday from 7 a.m. to 9 p.m. And so this is not a crisis line, but it's a great source of information and referral for caregivers to both local programs in their communities for themselves and the person they care for, as well as to the Ontario Caregiver Organization programs. And one of our most popular programs is our SCALE program, and it's a combination of webinars, individual counseling, and group counseling, covering many of the different themes that you can see here in terms of being mindful as a caregiver, having self-compassion, working through some of the emotions that can arise in terms of sadness, guilt, anxiety, and anger. And we get great feedback from caregivers on this program. We also have peer support groups where people can connect with others who may be having related experiences, and we invite you to join us for those if this is of interest. And we really want you to know that there are so many different ways that caregivers can be recognized and supported. So we want to make sure that caregivers know that we're here to help, and we invite you to share our website at ontariocaregiver.ca with caregivers and invite healthcare providers to sign up for our partner e-bulletin. This comes out quarterly. It shares updates on the work that we're doing, the information and resources and tools that we have. And we also have a monthly newsletter that we share it with caregivers that lets them know about things like our webinars, maybe new e-learning courses, new resources that we have for different caregivers in different types of circumstances. So we want to make sure that people are aware that we're here, that we work with health system partners as well as with caregivers directly, and that our focus is on how do we leverage the best practices that are available to engage with caregivers and to support them where they're at in their community and in the local context. So I hope this information has been helpful to you today, and I look forward to hearing from some of you or connecting you with members of our team to learn more.